Now, the Gauteng MEC of Health, Dr. Bandile Masuku, has demanded answers from the management of the Mamelodi Hospital east of Pretoria over the alleged abusive behaviour towards a pensioner. Now, a video of a 76-year-old Martha Marais went viral, showing her lying on the floor with her hands tied behind her back at a bench in the casualty ward. That went viral. Masuku and the Health Minister, Dr. Zweli Mkhezi, expressed outrage over the incident. Both the Minister and the MEC have instructed that a full investigation be carried out and that officials who were involved in the incident should not be allowed to interact with other patients. Let's cross now to our reporter live, Ofentse Setimo. He's live for us from our Pretoria offices. Ofentse, good evening to you. What's the latest regarding this shocking video that has gone viral, where we saw the elderly Marais there being basically tied to a bench at the hospital?
Well, thank you very much, Griselda. We were actually at the Mamelodi East Police Station today as the family of the 76-year-old Martha Marais went to try to find out if there is any charge they can lay against the officials at the hospital. As you mentioned, the MEC also visited and the minister expressed outrage, saying that there should be a full-on investigation into the matter. But the hospital, when we visited them earlier before the MEC's visit, actually mentioned that they've undertaken to investigate the matter to find out what exactly transpired, and then they said that within 72 hours they will release a report of the incident.
Certainly, I mean, from yesterday we saw members of the community as well as the family express outrage about this. Yes, now a case has been opened, but what else did the MEC and the Minister of Health have to say about what seems to be yet another incident of clearly officials within hospitals who have got absolutely no regard for some patients?
Well, the MEC didn't waste any time, and mind you, it's actually it was his first day, I believe, in office, and he visited the Mamelodi Hospital to try and find out. They actually want to get to the bottom of it, because they're saying that, you know, the reputation of Mamelodi Hospital leaves less to be desired. So they are in the process where they actually want to turn around the Mamelodi Hospital.
Well, Ofentse, obviously, you know, swift reaction, it seems, there from the authorities. But, you know, is there a likely suspension of those who were on duty? I know this report is expected in 72 hours, but is there a possible disciplinary action, even suspension, pending this investigation, or are those individuals still at work?
It wasn't quite clear, because the MEC, after his visit, issued a statement. In the statement, it says that those implicated will not participate, or they will not interact with patients, but it wasn't clear as to whether there is any action that has been taken, whether a suspension. Also, the wording was saying that they will not interact with other patients, so it wasn't quite clear.
All right, Ofentse, I mean, from some of the patients that had gone to the hospital for care today, did you get a sense from them if this is the norm at this particular hospital? What sense did you get from the patients there about the treatment that they get from staff there?
Well, even the staff themselves, you know, there's one who spoke to me on condition that is off record. He also mentioned that, you know, there's a lot of things that are going wrong at the casualty ward. It actually has 16 beds, but there would be, at a day, maybe 30 patients or more, you know. So there is overcrowding, there is understaffing. So there's a lot of issues. Also, in terms of the treatment itself, the hospital has built a reputation for being the hospital of death. People jokingly actually nicknamed the hospital of death, you know.
All right, Ofentse Setimo, thank you very much for your time. You'll certainly keep tabs on that for